Hello and welcome to Health and Wellbeing Live, sharing knowledge and experience from Nottingham City, keeping people informed about issues, people and services supporting the health and wellbeing of people in our good city of Nottingham. As always, this is a relaxed podcast style conversation pitched at an interesting and informed audience. So there will be little dumbing down and we'll be having real in-depth conversations about issues and services. It is open to anyone to listen, of course. Today, we're talking to Matt Corder, who is the Public Health Principal for Nottingham City Council, and Allison Jackson, who is Head of Service for Thriving Nottingham City. And of course, I'm, as ever, Dr. Andy Foster. I'm a GP. I'm an NCGPA Director, and I work at the Place-Based Partnership as Deputy Clinical Director. That's me. So welcome, Alison and Matt.
Hello.
Thanks for having us.
Yeah, that's great. So we've brought Alison and Matt on today to talk about Thrive Tribe. So this is the new health and wellbeing service for patients in Nottingham City. It's gone live this month, so hopefully it's going okay. But we thought it would be really important that people know about the service, how to refer patients in, what services there are, and who is eligible for them, and so forth. So really opportune time to get you on. So probably do you want to introduce yourselves? Maybe go with Matt first, and then Alison.
Yeah, thanks. So my name's Matt Corder. I'm the Public Health Principal for Health Improvement within Nottingham City Council's Public Health team. And within that portfolio, I kind of lead on with colleagues across the life course health improvement services. So it includes things like weight management, stop smoking, NHS health checks, oral health, 0 to 19 services for children, maternity and older people. So you can just see the kind of breadth of that. And our aim is to help people and support people to improve their health and wellbeing.
That's great. Thanks, Matt. And Alison, do you want to introduce yourself and tell us about your role?
Yeah, so hi, I'm Allison Jackson. I'm the Head of Service for Thriving Nottingham. And my role is very much around liaising with the public health team and the wider kind of NHS network across the city, and mobilising our client delivery team, who are going to be very much on the ground delivering behaviour change interventions for residents across the city. So really excited to be in the city. We've got a fantastic team who are busy completing their induction at the minute. I'm really looking forward to meeting lots of people.
That's great. And so, Alison, are you sort of the face of Thrive Tribe in Nottingham then, I guess, if people are having problems as, clinicians and so forth? Are you the point of contact?
Absolutely. So yeah, I'm definitely getting out and about, meeting as many people as possible. We do have a partnership and engagement team as well. So we've got a partnership lead. So Jamie will be out meeting lots of clinical teams across the city with Joseph. And then more locally across the city, we've got a team of community engagement coordinators who will be working in different areas across the city. So there's a big team of us. But yeah, absolutely. It will be me.
Great. And hopefully, if appropriate, we can share some of those contact details in an appropriate way with the audience as well, if they're having any snags that they can connect with your team. So that's great. My first question is, this is the first time I think that we've had a single provider of health and wellbeing services across Nottingham City, or at least in the time that I've been involved. Previously, my experience is that things can be a little bit, or have been somewhat fragmented, I guess, with individual providers providing different elements of weight management, smoking cessation, and the other things that comprise health and wellbeing service, and also often doing it for short periods of time. So sometimes the providers change, and it has been difficult to keep up with all the different organisations and all the different contact details and names of services. And it feels like this is a departure from that. Matt, I don't know if you can explain, why we've gone with one single provider this time and what the considerations were.
Yeah, of course. So I mean, the reason we've done it exactly as you mentioned previously within the city, we've had some really good providers, but like you mentioned, there was kind of 6, 7, 8+ different providers supporting people in different ways, different times, different access routes, and slightly different delivery methods. What we've done is come together as kind of a team in public health. We recognise, as is nationally recognised, that people's kind of health behaviours tend to cluster. So by that, I mean, people might they might smoke, and the reason that they are smoking could be around mental health. Alongside that, therefore, they might overeat, they might be inactive. And the point of bringing all these services together into an integrated service is that that person can be supported holistically in one place, rather, as you mentioned, being sent to different services, waiting on a response from them. That individual can come into the service, they can have a conversation, importantly, about identifying their own individual goals, their needs, some of their difficulties and challenges, and be supported within that kind of environment and on their journey, like I mentioned, in one place. And with that kind of continuity of being supported in some cases by the same individual. So a relationship, a rapport and trust can be built up to be able to enable that to happen. We've also kind of aware in Nottingham, we wanted to do something slightly different because there are health difficulties in Nottingham. Nottingham is the second highest local authority area for smoking prevalence in adults. We know that kind of 55% of our residents live in England's most deprived areas, so there are stark health inequalities. That's also matched around people's healthy life expectancy. So in Nottingham, and that's the number of years that somebody can in Nottingham can expect to live in good health. So in Nottingham, for kind of males and females, that's around 57 years. So almost a kind of third of their life at the moment can be impacted by poor health. So all of these kind of contributing factors, alongside the inactivity levels, the high levels of overweight and obesity in our children within schools, meant that we wanted to change something, create something innovative, but also something that residents can kind of access easily in one place to really start their journey to work on their health behaviours.
Yeah, thanks, Matt. And you've done a really good job of, I think, articulating why getting the health and wellbeing service right is really, really important for residents in Nottingham City, you know, as it is everywhere. But a lot of those things that you've described are those, wider determinants of health. You know, we often think about, people's access to their health services needs to be good, but actually we know that that's only 20% of people's health outcomes, and actually the rest is because of other factors, such as the ones that you've described. So actually for Nottingham City, it's really, really important to get this right. So Allison, can you tell us a little bit about what is Thrive Tribe? So you're new to the city. Other people elsewhere in the country might know all about you, but you're new to the city. So what is Thrive Tribe? And then begin to tell us about some of the services that you'll be providing.
Yeah. So Thrive Tribe are a provider of lifestyle kind of interventions. They're based in London, and they've been working really closely with Matt and the team at Public Health to kind of develop this new service, which will be called Thriving Nottingham, and is live right now, receiving referrals. The service offers Nottingham City residents a kind of one-stop solution to kind of stop smoking tobacco, and that's for children aged 12 above, to lose weight, and that's an adult weight management support program. And there's a variety of face-to-face, digital kind of offers there for people. There's also a child and family weight management program on offer. That's for children who are overweight with a BMI centile of 91 or above.
Mm-hmm.
There's also a programme that's being developed and indeed co-produced in the community for adults who are inactive, so currently undertaking 30 minutes or less of physical activity a week. So it's a broad-ranging offer for the city. The idea is that people can self-refer through our website, which is thrivingnottingham.org.uk. And fundamentally also, really importantly, clinicians can refer using their clinical systems. I'm assured everybody understands what an F12 functionality is on System 1, so it's an ability to pull through a referral straight away. And at that point, our health navigators will kind of undertake a phone conversation with the client or the family and understand what health kind of behaviours they're wanting to prioritise. And as Matt rightly says, it might well be the case that throughout somebody's journey with Thriving Nottingham, they see one member of our fantastic team and they help that person to begin to change more than one of their lifestyle behaviours. So it might be that they stop smoking in the first instance and then they work with our team to lose a little bit of weight. So it's a broad offer. It's really exciting, and hopefully you'll see us all out and about with the orange hoodies, orange or yellow, depending on how you can see us. But you shouldn't be able to miss us.
Great. And so I know some people will hear, I guess, that you're from London, and they'll sort of think, oh, will they be on the ground in Nottingham? I think I've heard that you will be, but people will be asking, how much of the service will be face-to-face in person, delivered in Nottingham in communities, how much is going to be kind of online and app-based? What's the kind of mix of delivery, Alison?
I would definitely say the priority is face-to-face delivery. The service has very much been constructed with the communities in the city really at its heart. So we do have a team of community engagement officers that will be going out, talking to residents in the city, developing kind of group opportunities and conversations regarding which of our offers they think are really going to work for them, or what changes we can make to make our offers really accessible. For people who don't want to kind of engage face to face, there are digital opportunities to stop smoking, for example, or lose weight. But this contract and this program is very much around delivery in the city. The team were actually out in Nottingham City yesterday doing some co-production. So they're kind of week 2 of their induction. And we very much see that continuing. I don't imagine people being working from home or from the office that much.
Okay, that's great, Alison. Matt, I was just wondering, what are your hopes for the service in terms of how this will help health outcomes in Nottingham and help Nottingham residents?
Yeah, so kind of as I alluded to earlier, we know that kind of smoking, diet, physical inactivity are at the root cause of many long-term conditions and reasons for poor health, and why people are presenting in our hospitals and GP surgeries. So ourselves in public health and the integrated care service, we talk about the importance of prevention and kind of giving our patients and our residents the best possible opportunity to live healthy lives. So ultimately, that's what we've designed this service to do. And importantly, as Ali's mentioned, this service has been commissioned for Nottingham and in Nottingham. It's not an off-the-shelf model. It's something that has been created, designed and developed with resident input to suit the needs of Nottingham and its communities. And to that end, community and access is very important to us. We know, and if we learn kind of one of the things we learned from the pandemic was around convenience and how important that is. So this service will have a number of access points spread across the city. It isn't just a city centre based location. And Ali, as mentioned, there'll be teams that are spread across the city in dedicated wards to create those relationships. And importantly, it will be a service that is embedded in the community, like I mentioned, so people can access it easily. They can walk there, they can use public transport, they can use their own transport to be able to have those conversations and access some of the programs. Secondly, I think what this service will provide is flexibility. So it is open 7 days a week. The services and programs will be available spread across there, recognising that our residents have childcare. Some work shifts, some work very busy 9 to 5s. So accessing these services is not always easy. And that forms part of the co-production to find out when, where and how we can offer these things that suit the community best. As Ali mentioned previously, and part of the model is around innovation. So there is digital aspects that people can use and start their health journey at their own kind of convenience and time. But behind those digital interventions is a human being able to offer bespoke and tailored support. And importantly, something with the relationship we've created with Thriving Nottingham early is the ability for the service to adapt to need. What we understand now as this service will not necessarily be the same service in 2 years, 3 years, 5 years time. This service we've committed to with up to a 10-year contract, which is again something that was really important to have that continuity and stability for not just residents but also healthcare professionals as well. And we recognise that health needs will flex during that time, and we've designed this service to be able to kind of flex and adapt to those needs as well.
Matt, you mentioned so community bases or community locations where the services may be delivered from. I'm just wondering if you've decided on those locations, if you know where they are. I know people will be out there listening thinking, oh, is there one near me? Has that been determined yet?
Yeah, so I know Ali mentioned the kind of the team have been out and about starting co-production, but as part of the Thriving Nottingham model, there's certainly kind of bases in key wards. Ali will kind of be able to allude to more detail with that and how the kind of community health coaches have been spread out to access the city. I know, having met the team last week, I was kind of hugely impressed with the diversity, the community representation. I know the team, there's kind of 9-10 different languages spoken within the team, all really important aspects to be able to increase access and trust. But Ali, I don't know if you just want to kind of jump in and talk about early plans for community access.
Yeah, so it is a universal service. That's probably super important. But we will be prioritising our face-to-face delivery in several kind of geographical kind of wards, as Matt said. So thinking about Bulwell, St Anne's, Top Valley and Bestwood, Bilborough and Broxtowe, Astley, Whitemoor, New Basford, Hyson Green as well, Radford and Clifton, the Meadows and Snenton will broadly speaking be where we begin, and where you can probably really expect to see face-to-face provision from the team. It's also worth mentioning we do have specialist health coaches who will be working with people with physical disabilities, learning disabilities as well, and that will also specialise in really supporting our global majority population in the city as well. So hopefully that helps.
No, that's really helpful. So it sounds like there's quite a range of locations. That's really reassuring to hear for people out there. And you were beginning to allude to my next question, actually, because I was just going to ask, acknowledging that Nottingham has some of the most deprived wards and areas in the country. It is up there in terms of deprivation. Nottingham is a really, really diverse city as well. There is lots of ethnic diversity, lots of language diversity and cultural diversity. And also, as you mentioned, there are people with sort of access problems, disability, these factors. What are you doing to ensure that you can be as inclusive as possible, and that these communities can benefit as much as possible from your service?
Yeah, I think this is where the co-production will really sit at the heart of certainly the early and ongoing work that the teams undertake. So the community engagement officers will be working in those communities. They live invariably in those communities, working with residents to design kind of programs that really are accessible and they're exactly what those communities want and need from us. So, like Matt said earlier, these aren't kind of off the shelf kind of solutions. Thrive Tribe definitely have a load of principles and programs that we can offer people, but how we deliver those in the city, we need to be really respectful and understand what the community want from us, rather than going and just doing things to people. That's not okay. So yeah.
Yeah, that's great. And I know that Matt's... Oh, God, Matt, you're probably going to say what I was saying. I was going to say, I know that your team has a lot of experience of co-production with, different either marginalised groups or, or different cultural and ethnic groups. But you were probably about to comment about all that. Go ahead.
No, yeah, thank you. I was just going to kind of add, and like we've mentioned, the aim is for the service to become kind of part of and the fabric of each community, which might mean adapting and being something slightly different in each of those wards that Ali's mentioned, because we want the service to be what local residents want it and need it to be. And kind of alongside that, I think for the service to reach its full potential, that involves working very closely with healthcare staff, including GPs as well, as part of the whole system, to work actively with the service, engage with residents before and after they begin their journey as well. Because any kind of resident's journey and the kind of the complexity of the patients that you'll know as a GP are dealing with will rely on kind of all of our involvement to help create kind of lasting, sustainable change. And as kind of Ali's mentioned, the important part is around identification of need as well. And as you said at the kind of start, Andy, around those kind of wider determinants of health, another key element of this kind of service is around identification of need around mental health, alcohol use, substance use, gambling related harms, and importantly, financial well-being as well. So part of that holistic approach will be conversations linked to those wider determinants of health and support within the service, but importantly, signposting to wider kind of services with expertise around that. So it really is kind of a multi-layered approach with multi-skilled staff to be able to kind of sit down with that individual, determine what their goal is, and kind of map out how we're going to get there and how we're going to achieve it for them.
Good. So just getting down to sort of the brass tacks as we get to the last bit of the conversation today. So my next question is, what specifically is available? What is commissioned within this service, and what is available, and who can access it? I'm going to ask you in a second how they access it, but probably those two things really. What is available and who is it available for? Maybe just take each thing in turn, or however you want to explain, but fire away.
Okay. So the service is available to people that live in Nottingham who smoke tobacco and are over the age of 12 or 12 and above, and who would like to quit. The service is available also for people that live in the city and have a BMI of 25 or above and would like to lose weight. The service is available and in development very much as part of that co-production, but for children and families where you have a child who is measured as being overweight. And the service is definitely available for people that are adults aged over 18 and inactive. The very best thing is to head to our website, thrivingnottingham.org.uk. You can sign up online and it will tell you super quickly if you kind of qualify for support from the service. And for clinicians in the city, they can use the templates on System 1 and very much if they would like to kind of meet with our team or have a clinical meeting to find out more about the service, we're very much getting to the point where we're raring to go. So if you pop us an email at hello@thrivingnottingham.org.uk, the team will absolutely get back to you.
Okay, that's great. Another question I've got is so what? Who don't you need referring to you or to see? So I'm just thinking from wearing my clinician hat. So I'm thinking perhaps if the problem is primarily a gambling addiction problem or more of a primarily a mental health problem, depression, anxiety. I'm imagining that the other services are still commissioned for those things, and that actually if the main problem is one of those things, then Thrive Tribe isn't the first place to go. I get the impression that you will signpost to those services if people come with a primary problem of smoking or weight management, but it's not the first port of call for sort of every sort of health and well-being issue. So am I right? Do you want to just speak to that for a second about who you don't need to see or what the kind of exclusion criteria might be?
I think that would definitely be true. What you've just said. To be fair, we're absolutely looking to support people who are primarily looking to get active, stop smoking tobacco, or lose weight. So that would need to be an aim or a goal for that individual. As you say, if somebody's got some mental health kind of problems alongside that, that doesn't necessarily mean we can't support them. In fact, they're welcome, and we could hopefully signpost them, as Matt said earlier on, to other support. We'd find it wouldn't be possible to support adults or children who have a known eating disorder. That wouldn't be possible as part of the service. And certainly adults with a BMI of 44 or over, or indeed a BMI of 40 with 3 or more comorbidities. So those would be the ones that spring to mind.
That's fine. I guess we have other services commissioned for those people for us in Nottingham City. So that's great. Matt, do you want to just come in?
Yeah, I was just going to say, exactly kind of as Ali said, ultimately in kind of a nutshell, the Thriving Nottingham service is being commissioned to support individuals who live within the city boundaries and or are registered with a Nottingham City GP. So that's kind of the key headline criteria. There are layers beneath it, as you and Ali have just kind of discussed. And the kind of last point I'd make on that, and an important point considering what we've mentioned around health inequalities, is that everything within this service is completely free of charge for residents. So there's no cost associated with it. The support at any point on their journey is free for them to access. So I think that's kind of an important point to make, that kind of that's something that our healthcare professionals and GPs can reiterate to our residents as well. Yeah.
Very good point. And sometimes there is a barrier, particularly if they see sort of branding that they think might be a bit corporate. This is council and NHS approved and funded. So very good message. So just finally, one last time, Alison. So how do citizens access the service, and how do clinicians refer? Just one last time.
So people within the city can refer using our website, which is thrivingnottingham.org.uk. Click the sign up button. Clinicians can refer using System 1. Our referral form is embedded within the F12 functionality, and you can make a referral straight away through that.
That's great. Is there a telephone number for people who aren't internet savvy, or do they need support from their clinician to get into the service?
There is a telephone number, and I'll put it on a slide.
Okay, that's fantastic. So there's a number as well. So,
There is.
thanks very much for joining us today. Hopefully everybody has learnt more about Thrive Tribe. What it is, why we've commissioned services in this way in the city, what is available, who it's available for, and how patients, citizens can refer in, and how clinicians can refer their patients in. Final question, and we ask everybody who comes on this podcast this question. So as people have stayed till the end and finished listening to the podcast, they'll be looking for something to do next. What would you ask people to do immediately after this podcast? We'll go to Matt first and then to Alison.
So I think for me, another element of this Thriving Nottingham service is about healthy conversations. Some people might know it as MEC, making every contact count. But I think an ask or a pledge for me on the back of this is just think about all of us at some point during a day or our time will have a conversation with somebody, whether we know them or not. But I would just urge people to kind of pledge and have that commitment to, if there's a window of opportunity there to talk to somebody about their health, whether that be physical or mental health, take that opportunity to kind of jump in and help and support. Thriving Nottingham is a potential or a signposting route on the basis of that conversation. But I think the more openly we talk about health, the importance of it and how we can support each other would be my key ask, I think, on the back of here.
Thank you. And Alison?
So I'd probably say that we're really, really excited to be working in the city, and we're looking forward to working alongside everybody that's already doing fantastic work in the city. So if you'd like to kind of meet with the wider team as a clinician or as a third or voluntary sector organisation or anyone, please just drop us an email at hello@thrivingnottingham.org.uk, and we'd love to have a chat.
Fantastic. Well, that about wraps us up, I guess. So thanks, Alison. Thank you, Matt. Thanks for joining us. And thanks for those people who have stayed and listened and watched till the end. Thank you very much. Goodbye.